hormonal contraception affect mood? Anytime that we have a conversation about the potential risks and side effects of contraception, we always have to balance that out against the potential benefits. The first of which is that it protects you against unwanted pregnancy, and pregnancy has risks associated with it, and those will include nausea and vomiting, more severely hyperemesis, diabetes, high blood pressure, preeclampsia, the risks associated with labour and delivery, as well as the mental health issues related to pregnancy. And actually it's estimated that up to about 1 in 5 people will experience some form of mental health problem during pregnancy and beyond, be that anxiety, depression or psychosis. So it's really important that we consider those benefits. Now there was a big study in 2016 which seemed to show an association between an increased chance of low mood that might require treatment with antidepressants and all forms of hormonal contraception, not just the pill, but also the mini pill, the implant, the coil, the patch, the vaginal ring. But this showed an association, not causation. It seemed to be that those two things were associated with each other, but the authors of the study couldn't say why that might be. What scientists do when we are looking at research is not only look at one particular study, which is almost like a snapshot in time, but instead look at the body of evidence, look at all the studies that have been done. And in 2018, a team at Ohio State University pulled the findings from 26 different research studies to see if there was a link between the combined oral contraceptive pill and depression. And they found that there didn't seem to be a significant risk. Another review in 2021 from the Netherlands also showed that there didn't seem to be an increased risk between the pill and depression, and actually that people were no more likely to report depression if they were on the pill as if they were on a placebo or a dummy pill. But there is absolutely no denying that anecdotally some people seem to feel that the pill and other forms of hormonal contraception seem to impact their mood negatively, that they feel low or depressed, while other people who have premenstrual syndrome or premenstrual dysmorphic disorder, which is almost like a very severe form of PMS, report actually that their mood gets better when they're on the pill. And it seems that in some people it makes it worse, and in other people it makes it better. And this might be due to a metabolite, a breakdown product of the hormone progesterone, which is found in hormonal contraception. Now this progesterone metabolite, called allopregnanolone, seems to affect people in different ways. Some people respond negatively when they have a lack of it, and others respond negatively when they have too much. So actually we're looking at treatments that both increase it and decrease its effect. It works differently in different people. So it may well be that one pill which affects one person one way may not affect someone else another way. The other important thing to remember is that we use hormonal contraception for all kinds of things which aren't just contraception. We might use it to help control heavy periods or painful periods. It means that you're missing school or work, and some people are unable to simply leave the safety of the bathroom due to how heavy their periods are. We use it to treat acne, to treat endometriosis, adenomyosis, PMS, PMDD. The list goes on. Does the pill and hormonal contraception cause depression? Depression and mood and mental health are complex and complicated, but in some people they might have an effect. But that has to be weighed up against the risk of an unwanted pregnancy and any other potential benefits that you might be using that form of contraception for. Everybody has the right to make those informed decisions because you are unique, and so too will be your choice of contraception. Stick around, hit subscribe and follow if you would like more.